Welcome, everybody. Thank you for being here. We'll give everybody just a few more minutes before we get started. All right, well, thank you for being here. We're going to get started with community health workers, the key to addressing health disparities and achieving health equity. Today is Thursday, March 23rd, and as like I said before, welcome and thank you for joining us. This is being recorded, and feel free to keep your cameras off or turn your cameras on. You will need to get permission to be unmuted. So I'll be speaking today. I'm Tanikka Price. I'm the Chief Education and Equity Officer for Health Impact Ohio and the Central Ohio Pathways Hub. I also oversee the Central Ohio Pathways Hub CHW certification program. So I'm just really happy to be here talking about CHWs, which are such an integral part of our work. Yes, if anybody has any questions, please just drop them in the chat and we will get to them as we go. So our Health Impact Ohio's mission is to improve social drivers of health, health equity, access, and quality in all communities through community engagement and partnership, multi-stakeholder training and coaching, data collection and integration, and strategy development and deployment. Our vision is we believe in optimal health outcomes for all individuals in every community. So today what we're going to go through, we've already done welcome and introductions. I'm going to talk about the role of a community health worker, how CHWs work in the community, and then end with a CHW testimonial. So this is me in 2011 in the beginning, and I like to call myself the no boundaries, no limit CHW soldier. I became a CHW because I had a CHW when I was pregnant with my twins, Makai and Kiara. They were born at 26 weeks and 6 days, 2 pounds and 3 ounces. During this time, I had a community health worker visit me in my home along with a nurse, and they helped me to plan for if I did go into preterm labor, which I didn't think I would, who would go grocery shopping, who would take my other kids to school, and how we would get through those months should I be hospitalized. Sure enough, at 21 weeks at a doctor's appointment, I found out that I was in labor. I didn't feel anything, but I was getting a transvaginal ultrasound and found out that I was in labor. I went on complete bed rest in Mount Carmel West, where I remained for 5 weeks until the twins were born. Now, having gone through that, I wanted nothing more than to give back to the community the same way that someone had given to me. I had a law degree, but I had been unable to pass the bar exam at this time. And so I decided to call the supervisor of the program that I was in. It was called Caring for Two at Columbus Public Health. And I decided to call Grace Kalasua and ask her if I could work for her. She told me that I could be an outreach coordinator, outreach worker, but she could only pay me $11 an hour. So I started my job at CPH as an outreach coordinator. And I was determined to meet every mom's need in every way possible. I didn't have any boundaries. I didn't have any limits. I was a 24/7 CHW. And as you might already be thinking in your head, I soon burned out. So I found myself in the hospital for 10 days, diagnosed with nothing but exhaustion, because I was trying to be all things for all people, including the 5 children that I had at the time. And that's impossible to do if you're not taking care of yourself. So this is where I started to learn about CHW as a career. I started to learn the importance of CHW self-care, how vital that was to CHWs, because most people go into the CHW career wanting to be helpers, wanting to give back, wanting to see people who look like them, who were in situations they were in, and make sure that they have everything that they need. And guess what? That can lead to burnout. So I started to supervise CHWs and built this community health worker program that I'm going to talk about tonight. So what is a CHW? What is a community health worker? Well, a community health worker is an individual known in the hub as a care coordinator, and we'll talk about what the hub is shortly, who lives, works, or worships in the community that they serve. CHWs are employed at care coordination agencies, CCAs, as well as various medical and social service providers. CHWs are experts at connecting their clients with quality care and services to address the health risks that affect their lives as they reside in at-risk communities. By making connections that link individuals with the resources and services which specifically meet their needs, they help to address their clients' social determinants or social drivers of health. What are some of the role of CHWs? CHWs are trained in healthcare competencies such as basic anatomy and physiology, CPR, radial pulse, knowing when to call 911, and knowing documentation methods. They're also trained in community resources such as identifying and referring to local resources, your WIC, your car seats, your pack and play, okay, your food pantries. Also, they're trained in communication skills, interpersonal communication, as well as written communication, nonverbal communication, and health literacy, and also individual and community advocacy. They learn how to advocate for themselves by exercising self-care. They learn how to advocate for others by recognizing diversity and advocating for underserved populations. They learn about health education, such as lifestyle choices' impact on health, the identification of addiction and oral health and first aid. And then finally, service skills such as safety, basic office skills, time management, and conflict resolution. I wanted to share this because in 2018, there was a study done across Ohio for all CHWs, and here's some of the findings. 90% of the CHWs that work in Ohio connect clients to community resources. 89% educate clients about how to use health and social services. 86% motivate clients to obtain care and other services. 75% provide information so clients understand how to prevent or how to manage health conditions. And then another 75% conduct home visits to provide education, assessments, and social support. So this is the bulk of the community health workers' workload. Everything from connecting clients to community resources, to conducting home visits to provide education, assessment, and social support. Who employs CHW? Well, CHWs are employed by care coordination agencies, community-based organizations, federally qualified health centers, urgent cares, hospital settings, and primary care facilities. CHWs work. Here's the top 10 settings where CHWs work. 79.4% work in the client's home. That's where they interact with the client. 59.6% at an agency location. 53.9% community events. 31.9% community health centers. 31.2% shelters. 31.2% hospitals. 31.5% public housing units. 26.2% at school, 22% at private clinics or medical practices, and 21.3% at the client's work site. Okay, so this is where CHWs spend the majority of their time. We're still trying to make the case for hospitals. We do have CHWs employed in hospitals, but I think what has been difficult for people to see is how CHW works with a larger healthcare team. So this is basically to show that we have individuals who start at home and then they go to primary care where they may or may not be sent to a hospital. When a CHW interacts with a client at the hospital, helping them with key transition tasks such as assessing post-discharge needs, assisting with discharge planning, including making appointments and medication and patient education. They help them transition to home through community-based services such as transportation, Meals on Wheels, or home support. And then while they're at home, they help them with key tasks such as confirming scheduled appointments, reassessing transportation needs, confirming that their medication has been obtained and that they're adhering to the medication regimens, identifying and reporting concerning symptoms, reviewing patient instructions, and confirming health insurance. All those things help to keep the client from going immediately back to the hospital, okay? And then they're able to return to primary care where CHWs are able to provide up-to-date contact information, help to reschedule appointments, and inform nurses about patient concerns and symptoms. So this helps keep people from going straight back to the emergency room and helps them go through a continuum of care that is more beneficial to the entire healthcare system. When CHWs were asked and interviewed, they reported a high job satisfaction. Employers, when they were asked to interview, report that CHWs are valuable members of the healthcare team. The average salary range in Ohio in 2018 was between $30,000 and $35,000. It was noted that there's no significant difference between the pay of certified CHWs versus the pay of non-certified CHWs. And we'll talk about certification in just a minute. Many CHWs did report feeling underpaid. Most CHWs are supervised by a nurse or a social worker. 20.1% of employers surveyed do not provide any specific training towards the supervision of CHWs. That's a gap. Only 29.5% of employers surveyed provide training on how to integrate CHWs into the healthcare team. Some of the challenges that came up when interviewing CHWs and supervisors is difficult to find and maintain employment as a CHW in Ohio. Some positions require a bachelor's degree, while you only need a GED or a high school diploma to get a CHW certification. Life experience is not always counted by hiring managers. So there's really not a way to put down life experience on a resume. There's little job security due to the nature of grant funding. So a lot of these positions are grant funded. There are high caseloads for CHWs and sometimes unrealistic expectations about what they are expected to do in the workplace. And then there are some employers or supervisors who do not adequately understand the roles of the CHW. And unfortunately for some CHWs, there are few or no advancement opportunities. Funding for CHWs, so we want CHWs to make a living wage. So the national estimate for community health workers puts their mean wage estimate around $22 an hour or $47,780 a year. You see here that what is needed for them to have a living wage is somewhere around $61,010. And of course, this is a national estimate. So it's going to be higher or lower depending on where you are. Examples for where we go to for funding for CHWs. A lot of CHWs are funded by grants. So again, those CHWs who are funded from grants report job insecurity and limitations in their scope based on the priorities of the grants. The grants may just be targeting pregnant moms, or they just may be targeting the elderly, or they just may be targeting people with asthma. Okay, so there's limitations in the practice based on the grant. Also, insurance reimbursement is reported to be received by 37% of those employers surveyed. And out of those, 51% are Medicaid, 49% are Medicaid managed care, which includes our Pathways Hub contracts. 24% is private health insurance, 14% is Medicare, and 6% are state children's health insurance programs. The Ohio Department of Medicaid allows managed care plans to have the flexibility to use any provider that they deem necessary to advance population health outcomes. So most employers for managed care plans feel that their funding mechanisms for CHWs are sustainable. Here we have a map of the entire nation, and what it shows are the different reimbursement mechanisms for different states. So we'll start with the purple. These are states that reimbursed for CHW services through its Medicaid programs, and that's 15 states. In the green, you have Medicaid does not directly reimburse CHWs for service, but MCOs do reimburse for services or hire CHWs directly. That's 10 states, including Ohio. And then in the lime yellow is these states do not reimburse for CHW services through Medicaid programs. And unfortunately, that still remains 27 states. And then we have Minnesota, for which this information was not available. Here's another map of our country, and this shows the level of CHWs per state. So the deep green have the most, with between 1,600 and 7,750 CHWs. Next is a lighter shade of green with between 610 and 1,500 CHWs. Next, there's Army green between 370 and 550. And then the lightest green is 90 to 350 CHWs. So as you can see, in Ohio, we're doing really well as far as the number of CHWs go. And this was as far back as May 2021. Now let's talk about what we do as far as our state for certification. In Ohio, the Ohio Board of Nursing issues and renews CHW certificates as authorized by House Bill 95, which was enacted in 2003. The certifications are to be renewed biannually. Training programs must be approved by the Board of Nursing and include at least 100 hours of classroom instruction and 130 hours of clinical instruction, including a standard training exam. Certification needed in order to perform tasks delegated by a nurse. So there are some approved tasks that can be performed by a CHW, but they need to be supervised by an RN. The standard minimum curriculum for community health workers shall include courses, content, and expected outcomes relative to the defined roles of the community health workers in the 6 areas that we already spoke about: healthcare, community resources, communication skills, individual and community advocacy, health education, and service skills and responsibilities. The standard minimum curriculum for community health workers shall also educate students on needs throughout the span of a lifetime, including the family during childbearing years, the family during pregnancy, the newborn infant and young child, adolescents, and special health care and social needs of target populations, such as grandparents raising grandchildren, adults caring for aging parents, and children and adults with disabilities. And our curriculum covers all of that and then some. Every 2 years, a CHW needs to show that they have 15 hours of continuing education. And again, that recertification is done by the Ohio Board of Nursing. So as I said, the Ohio Board of Nursing issues and renews CHW certificates biannually. In order to be certified, individuals must be at least 18 years of age, have a high school diploma, complete the CHW training program, and pass a criminal background check. CHWs must be supervised by a health professional and are restricted from performing services requiring a professional license. So they cannot handle tasks that should be done by an RN or a doctor or a social worker. Per Ohio Administrative Code Rule 4723-26-05, all Ohio Board of Nursing certified CHWs are required to renew their certification in March of every odd year. A certified CHW's first renewal only requires the CHW to confirm during that renewal process that it's their first renewal. Afterwards, certified CHWs are required to obtain 15 contact hours through educational activities that meet the continuing education requirements. So why certify? I already told you in a previous slide that there's no monetary incentive to certify because most CHWs get paid the same amount whether they have a certification or not. Here are the top 3 attitudes of certified and non-certified CHWs about certification. And this was again in the 2018 Community Health Worker Statewide Assessment conducted by the Ohio Department of Health and Ohio College of Medicine Government Resource Center. 76.5% of people felt certification better equipped them to serve the community. 63.4% thought that certification gave value to the profession. and 52.1% thought that certification increases the respect from the community. These are all reasons why we started a certification program and we maintain a certification program. On the other hand, what does CHW say were barriers to certification? And these are some things that our certification program has tried to address. Number one, training programs are too long. Number two, training programs are too costly. There's not enough affordable continuing education opportunities, and the certification does not make a difference in terms of pay. Number three, the location of training programs are not accessible for all CHWs, and there's not enough accessible continuing education opportunities. Number four, the process of certification renewal is not clear enough, and some CHWs in Ohio are not even aware that certification exists. And then finally, number five, background checks prohibit some CHWs from ever getting certified. We've tried to address some of these. So our training program is 12 weeks. We meet 3 times a week for 2 hours at a time. We've tried to break that long period of training down into something that is more palatable. We also try to help connect CHWs to affordable or free continuing education opportunities. I'm happy to say that since COVID, there are a lot more continuing education opportunities available online, and there are a lot more that are available for free. We have started during COVID, so of course our initial trainings were online, but we found that we were able to reach a larger audience, people who would not have been able to come in our sessions because of childcare, because of transportation, or because they live too far from Franklin County. So we've actually been able to make this more accessible for a lot of people in the entire state of Ohio because we are a virtual program. We try to make the process of certification renewal clear. We email all of our past graduates to tell them details about how to renew their certification. We send them the link, along with if anybody's ever not able to pay, we are able to pay for them. We can't do anything about the background checks that do prohibit some CHWs from getting certified, but we let all of our students know, regardless of whether they get their certification from the Board of Nursing, they are still able to take our class and be certified through us from our training program. So our mission at our CHW certification program is to educate and empower community health workers to be competent and valued members of the healthcare system and the greater community. Our vision is to create a trusting learning environment that prepares community health workers to use their knowledge and life experiences to improve health outcomes, provide health equity, and eliminate health disparities in the community. Our CHW certification training started in July 2020 when we got our approval from the Ohio Board of Nursing. And since August 2020, we've had 4 cohorts that have been certified by us and gone on to get their certification from the Board of Nursing. We are currently teaching the largest class, which is 43 students, and we have a huge mix in this class. We have high school students. We got a grant from ODE, the Ohio Department of Education, to be able to provide the CHW certification training to high school students. And we have welcomed them into our class where they are valued members of our class and absolutely participate. We have individuals who are currently working as CHW. So the largest number of our students are currently working as CHWs. However, they have never had the time to get their CHW certification. We allow them to use their own job where they're working as a CHW as a practicum placement. And we were the first in Central Ohio to do that. I'm also excited because last cohort, we graduated one individual with a PhD, and we've welcomed another individual in this cohort that has a PhD. They both wanted to get CHW certification training so that they're able to be boots on the ground and serve their community in a different capacity. Our CHW certification program is offered each spring and fall. As I said before, it is virtual, so we do meet over a virtual platform. It allows for the practicum placement at the CCA where they are employed. We meet 12 weeks, 3 hours a day, 3 days a week. And then upon completion, we assist with their application to the Ohio Board of Nursing. We do pay for that initial application. During our course, students also get CPR training, first aid training, and Mental Health America first aid training. Requirements for the Ohio Board of Nursing, again, are just high school diploma or GED, 18 years of age or older, and being able to pass an FBI background check. Our course description is students are introduced to community health concepts, resources, and skills of a community health worker. They are introduced to the role and responsibilities necessary to become a community health worker. Our curriculum emphasizes such topics as impact of culture and socioeconomic status on an individual's health and the built and lived environment, communication, barriers to obtaining healthcare services, professionalism, and community resources. Where are areas for training improvement? So again, in that 2018 CHW statewide assessment done by the Ohio Department of Health and Ohio Colleges of Medicine Government Resource Center, people said things like to add or enhance curriculum on professional and soft skill. So we've done that. We have added curriculum on professional and soft skill. We also model professional and soft skills throughout the class. And if there are students afterwards who have not been in a job field, we send them to partners like Dress for Success to get additional professional and soft skills. They would like more information and access to free or low-cost continuing education opportunities for certified CHWs as needed. I've already discussed this, but we do help our students access free or low-cost CEs, especially those that are online and easily accessible for them. They ask for a unified core training for certified and non-certified CHWs. So we've worked toward that with our CCR grant, which is our COVID Communities Resilience Grant by the CDC. We offer training bi-monthly, twice a month, for both certified and non-certified CHWs, where they can get the same information to take back to their clients. Expand or enhance curricula to reflect the varying roles and responsibilities that CHWs are asked to fulfill in the field beyond a focus on nurse delegation tasks. Again, we've done this. CHWs are employed by different names, patient navigators, for instance, care coordination coordinators. So there are different names, and we train them on how these different roles may be, how they may look different in different places. You may be asked to do different things if you're in a hospital versus if you're in a community-based organization. They asked for an annual conference focused on CHW professional development. As of last spring, HIO and the Central Ohio Pathways Hub had our first conference. It was online, and we are preparing for our second conference, which will be this fall in person. And then finally, include content on teaching CHW self-care to prevent burnout. Well, obviously, since that was such a core tenet of my own profession as being a CHW, I made sure that self-care was just going to be a real touchstone in our class. It's something that we come back to over and over again. And there is absolutely training on self-care and how important it is for CHWs. Now we're going to transition a little bit. We're going to talk about the Community Pathways Hub, which is an evidence-based model for community health worker-led care coordination. The hub model was started by Drs. Mark and Sarah Redding, who crafted the hub after years of working with CHWs and seeing the efficacy of CHWs working with vulnerable populations. The hub model is currently certified by PCHI, which is the Pathways Certification Health Institute, Pathways Community Hub Institute. Sorry about that. This was all initiated by Senate Bill 332, which was sponsored by Senators Charlita Tavares and Jennifer Jones and passed on April 6, 2017. This provided public policy support to decrease infant mortality and also provided the following: CHW certification standard through the Ohio Board of Nursing, as well as certified pathway standard. And it also provided for reimbursement through Medicaid and managed care plans. The hub service region. So hubs are found in many cities and counties across Ohio. So you see here we have the Ohio network of hubs. We've created a network of certified pathways community hubs And here are some of the regions that are represented. Here's an example of a flyer that we did in order to showcase the work that we were doing during the pandemic. Our specific Central Ohio Pathways Hub service regions are Franklin, Licking, Delaware, Union, Fairfield, Pickaway, Madison, Marion, and Ross counties. So through the hub, our three main tenets are to find, treat, and measure. Find is a comprehensive risk assessment. So CHWs use a comprehensive risk assessment called the checklist to assess the client's current situation. Next, treat. The CHWs identify issues and open corresponding pathways with which to work on with the client. And then finally, measure. CHWs use tools to measure the success of goals that are created with the client. So this is an example of a flyer that we might put out. You deserve to have the healthiest life possible. The Central Ohio Pathways Hub community health workers can connect you with coordinated healthcare and access the services such as signing up for health insurance, unemployment, food assistance, finding employment, housing, and medical care and education, managing your health and well-being, including understanding illnesses and medications, and then family planning, pregnancy care, and care for you and your entire family. One of the great things that I love about the work that I do now, I moved from infant mortality to looking at this life course model, everything from pregnancy to interconception, to looking at the entire family, a holistic view of helping our families and our communities get better. That's what we do at the hub. We like to call the hub a good middleman because we work with the managed care organizations and other funders to get reimbursements to the care coordination agencies. All the care coordination agencies have to do is employ the CHW, and then the CHW works directly with the client to provide the resources and services that they need. And then we're able to bill the managed care organization for those services, and we get the reimbursement, and then we disperse it out to the CCAs. So all the CHWs have to do is complete checklists, pathways, and tools. The supervisors review, and then they sign when complete. And then the hub staff reviews and signs, sending back if there are any errors. And then once a month, an invoice is generated through our IT system. An invoice is then sent to the corresponding managed care plans, and payment is remitted to HIO and then dispersed to CCAs. We like to give the CHWs and supervisors tons of support. So we never just leave them out there. We never just, we do a 3-day onboarding, but we don't just onboard them and then leave them, okay? We like to give them a lot of support. So one thing we do is we help the CHWs learn how to complete their checklist, pathways, and tools. And then we help the supervisors know what they're looking for when they're reviewing and when they're signing, okay? So that they're able to send back anything that needs to be changed or completed. And then we're all trained, so we know what to look for when we're signing, because when we send it to the managed care plan, we want to ensure that it's going to be paid for. And then we complete the invoice. So we make sure that the managed care plans get the invoice that's generated through our IT system. And then we, again, we get the payment ourselves, and then we disperse based on those line items to the CCAs. Okay, so there's nothing that they have to do. So now I'm going to just share with you a video. You give me 1 second. And this will be just a little bit of perspective from the CHW. We love to have our CHW students, when they're in our class, hear from CHWs, because, it's one thing for me to tell them what it's like to be a CHW, but it's another thing for them to hear it from a CHW. So we do a class called The Roles and the Goals of CHWs. And as part of that, we shared this video.
Hello to
So
the
give me 1 second so I can share.
new class. Hello to the beautiful new class of community health workers. I'm excited for you guys to be on this journey, and I'm here to talk about my experience as a community health worker. So my name is Emily Johnson, and I graduated or completed my CHW certification in November of 2018. I was initially, well, at the time, maybe I didn't know exactly what a community health worker was. My background is in public health. However, I did complete a bachelor's degree in public health in Salt Lake City, Utah. And I really knew that this field or community health was my life's calling. From the first time I learned about what social determinants of health were, I will never forget feeling like I want to dedicate my life to addressing the SDOH. And yeah, I think that the work is incredibly important to our society as a whole, especially involving the healthcare world. And I'm so excited to see that there are more and more community health workers joining the workforce and addressing the SDOH. So yeah, initially I was looking for a job in the realm of public health, and the CHW is just that in essence. And so after I graduated and got my certification, I then began working at Heart of Ohio Family Health Centers. If you guys are not familiar with Heart of Ohio, we are a federal qualified healthcare center. So we receive money from the federal government to help support individuals that are underinsured or do not have insurance. We offer a sliding fee scale, and we do a ton of services from primary care to obstetrics to counseling, nutrition services, etc., including the community health worker social services. So that's kind of where I've been since 2018, and I have found it to be incredibly challenging. And also when I envisioned myself graduating with a degree in public health, this is exactly where I saw myself working with individuals who have these really complex and really unique situations that medical providers just can't address on their own. And that's why I've enjoyed being a community health worker so much, is because we are the eyes, we are the ears, we are the mouths of certain scenarios, certain people, certain systems that have under support. I primarily work with families, but you can say that with just individuals. In the essence of knowing the patient or the person as a whole, you know the family, you know their background, you know where they're coming from, and you're the advocate for that family or that person. You're the one that's explaining the situation, whether it's to the school, whether it's to another healthcare provider, whether it's um, to job and family services, whoever it is, you're the all-encompassing representative of that family or that person. And I think that holds a lot of water for really supporting these people in really dire situations. You are going to come across such unfortunately difficult scenarios in which there's not a resource for that person and there's not an easy answer, you know. That's why we're here, to exist in this space, because no one else can. And it's really tough, but it's also insanely rewarding, and you will never feel like your job is not worth anything. Every day you will come home and you will know that in your heart, I have done something for someone. Even if it's as little as I helped a family who speaks French enroll their child in an all English speaking school system, or being able to help an individual who is undocumented, has just arrived in the United States 3 months ago, has no idea how to navigate our healthcare system, and is about to give birth to a child 4 weeks later. You know, these scenarios, is every case is different, and that's another reason why I love this work, because it's never, you never have a dull moment. There's always something challenging you as well, and you will grow in so many ways, professionally and personally, you could say as well. So I'm very excited for you guys to join this workforce. I hope you love it so much. And some advice that I would give you to be successful community health workers is being incredibly open, meaning that your communication is open. I really encourage you guys to look into explicit and implicit biases, to really pay attention to preconceived judgments you may have about certain type of individuals, and constantly working to address those biases and preconceptions that you may have about someone. Another important factor in being a successful CHW is being incredibly organized, because when you're organized, you're reliable. And when you're reliable, your patients are going to trust you, and they're going to know that you're on their side and you're doing what you say you're going to do. I think that's something that is found success, I hope success, for you and for me. And yeah, so congratulations on this journey, and I hope that one day I'll see you out there.
I really wanted to share that because not only is she just great at what she does, but also she just touched on so many points, you know, that are important to CHWs. And I really thought it was, you know, best to hear it from her. She actually, in addition to being a CHW, is currently in school to be a certified nurse midwife. So, you know, she's used the CHW as a continuum and continues to serve her community. I'm going to show one more video and then I'll take questions. This is from our high school students from the last cohort. Sorry about that.
Well, my name is Jade. I go to Reynoldsburg and I'm 16. I'm a junior. And yeah, I want to go to nursing.
My name is Vivian Yopane. I'm 16 years old. I'm a junior in high school. I go to Reynoldsburg High School. I want to become a doctor.
I'm also 16, also a junior, also go to Reynoldsburg High School, and I want to be a neurologist in the future.
My name is Michelle Odra. I'm a sophomore at Reynoldsburg High School. I still haven't chosen a specialty,
but I hope to do something regarding medicine.
Hi, I'm Shandana Adhikari. I'm a Reynoldsburg High School student who is a junior. I'm 17 and I want to be a nurse practitioner.
It's been a great opportunity. A few times in my own health classes at school, I've been able to apply knowledge that, you know, apply knowledge that that was new to me and I haven't heard before. But also an aspect I love about this class is that a lot of the time when we think of health or the healthcare industry, sometimes our minds immediately jump to a very technical and strict side. So we might think of diagnostic tests, drugs, difficult medical terminology. But it was refreshing in this class to see the social aspects of health being addressed, such as health inequalities, and everything that can happen behind the scenes. So in the class, we identify problems such as why a patient may not be able to present to an appointment. And instead of stopping there and putting the blame on the client, we then ask ourselves, what can we do about it? What programs are available to help them? So it feels new and inspiring to see these things being addressed and recognized when many times before they have been taken for granted.
This class really helped open my eyes to like many things I hadn't thought about before. Like obviously I knew there was discrimination, but I didn't know there was like so much of it in healthcare.
So I'm currently enjoying class so far. I've been learning a lot from all the lessons that we've gone over. And I'm really excited to continue forth with this class. This class has allowed me to learn more about different communities. And I'm hoping to take the knowledge that I learned from this class and also apply it to my community and other communities as well.
I'm very happy that I'm taking this class too because like I'm learning a lot and stuff. And like in the future, I feel like I can like apply a lot of things. I can like even like when the teachers are like talking and like talking about the topic, I'm like, oh my god, I already know about this stuff. Like it's just like so amazing, like knowing this like beforehand stuff.
I actually really enjoy the class. I'm learning a lot more than I think I would even learn in school because we cover a lot of stuff. Like every class, there's like new and interesting facts and the numbers about everything. I'm just like, oh, that's like cool to know. So I mean, even though like some parts of the class I can't really like speak on because I don't have experience in them, it's still cool to like know about it and hear everybody else's point of view on how all that stuff is.
My career goal hasn't changed, but this class has helped me acknowledge the various resources that are available for patients. So in circumstances where I might not be able to help my patients medically, I can help them emotionally and socially with the resources that I'm learning from this class.
The class has exposed me a lot to just the realities of the world. So while it can be disheartening, at the same time, it challenges me to want to change. And then really anything in the class it seems like it can be put into any career because of how just useful the information is.
I will say that I do want to go into nursing, so it's really important that I know a lot of the stuff that we cover. But when I first, like before the class, I was thinking more of like the technical and biological part of nursing and not as much about the social part of nursing. Like I knew I was gonna have to interact with patients, but all this stuff is stuff that I'm gonna have to like put in the forefront of my brain when I'm talking to a patient in the future. So now it's kind of good to know some of this stuff ahead of time.
As a future healthcare person working in the healthcare industry, I feel like I'll be able to apply everything I've learned in this class to make my patients feel more accepted, even if I won't have as much time together with them as I probably won't. Like my goal is not to be a CHW in the future, is to be like an actual doctor. So like, but I still feel like I'd be able to help them feel included and help them feel like they matter because of what I've learned.
In the beginning, I thought like this CSW, like it didn't meant a lot to me, but like now, like it motivated and inspired me to like do what I want. Like I want to like do it like very badly now, like way inspired and motivated to like make a difference in the community.
It's hard for me not to get like choked up watching that every single time, and I've seen it multiple times, but just knowing the impact. And again, training high school students was one of our long-term goals that we've been able to reach sooner rather than later. And you know, none of that was scripted. We just put them in a Zoom and had a conversation, and that's what came out. And it really means a lot that they're taking away that much from the class. So now I want to answer a couple questions in the chat. One is, can you talk a little bit about how CHW is different from social work? Yes, that's a great question. So social workers are also a helping profession. My mother and my grandmother were trained as social workers. There's a lot of overlap in terms of connecting the community and the clients to resources and services. I think the main thing is that a CHW is a paraprofessional. So we really, we want CHWs to be themselves, right? Like social workers are trained to be, you know, professionals and to come in maybe dressed like I am today. But CHWs are trained to mirror the communities that they serve. We want them to look like the communities they serve. We want them to dress like the communities they serve. We want them to talk like the communities they serve, whether that's speaking colloquial, hey man, what's up, how you doing? Or whether it's speaking literally their own language. CHWs meet clients where they are. CHWs are not asking clients to come in the agency and sit at a desk and fill out paperwork and talk to them. CHWs are filling out the paperwork for their clients. They are asking very casual questions. How's your housing? Do you have a doctor that you see regularly? Tell me a little bit about your previous pregnancies, in a very conversational tone that builds trust. So CHWs really are what we want to refer to as boots on the ground. When I was a CHW, I would have people leave their doctor's appointment and the doctor says, do you understand everything? Do you have any questions? They say, no, I understand. And then they get in a car and they call me and they say, what does this mean? The doctor said the baby has such and such. And then I was able to give them in vernacular or break it down in a way that they can understand by using a metaphor. I could speak their language and then they say, oh, okay, that's what that means. So there's a reason why we are not getting compliance from doctors, and we're not getting compliance from social workers. There is a divide between the professionals and the community that we want to serve. And CHWs absolutely bridge that gap and fill that gap. Any other questions before we wrap up tonight? Okay. Well, thank you all. Again, my information is at the end of the slide. So if you want to contact me, if you have any further questions, it's Tanikka, 1 and 2 Ks at healthimpactohio.org. You can feel free to log into healthimpactohio.org, our website, or find us on social media. We're on Facebook, LinkedIn, Instagram, and Twitter. Just search Health Impact Ohio. Thank you all for having me tonight. And I hope that you were educated on the impact and importance of community health workers.